Title: Understanding Intracranial Hemorrhage Causes, Symptoms, Diagnosis, and Treatment. Introduction. Welcomedo, our comprehensive lecture on intracranial hemorrhage. In this video, we'll explore the causes, symptoms, diagnosis, and treatment options for this serious medical condition affecting the brain. Definition: Intracranial hemorrhage, often abbreviated as ICH, is bleeding that occurs within the skull, leading to the accumulation of blood in or around the brain. This can result from various causes, including trauma, hypertension, vascular malformations, or bleeding disorders. Causes: There are several potential causes of intracranial hemorrhage, including traumatic brain injury such as from falls, motor vehicle accidents, or sports-related injuries. Hypertension: Chronic high blood pressure can weaken blood vessel walls, increasing the risk of rupture and bleeding. Cerebral aneurysm: A bulging, weakened area in the wall of a blood vessel in the brain, which may rupture and cause hemorrhage. Arteriovenous malformation: an abnormal tangle of blood vessels in the brain that can rupture and bleed. Coagulation disorders: Conditions that affect blood clotting, such as hemophilia or anticoagulant medication use, can increase the risk of bleeding. Symptoms: The symptoms of intracranial hemorrhage can vary depending on the location and severity of the bleed. Common symptoms may include sudden severe headache, nausea and vomiting, weakness or numbness on one side of the body, changes in vision or speech, loss of consciousness or coma. Diagnosis: Diagnosing intracranial hemorrhage typically involves a combination of clinical evaluation, imaging studies, and laboratory tests. Imaging modalities such as CT scan or MRI are commonly used to visualize the extent and location of the bleed. Laboratory tests may be performed to assess coagulation parameters and rule out underlying bleeding disorders. Treatment of intracranial hemorrhage depends on the underlying cause, severity of symptoms, and extent of the bleed. Treatment options may include monitoring and supportive care, close monitoring in a hospital setting to assess neurological status, and manage symptoms such as elevated intracranial pressure. Surgical intervention: In some cases, surgical procedures may be necessary to evacuate the hematoma, repair vascular abnormalities, or relieve pressure on the brain. Medications to control blood pressure, reduce swelling, or prevent further bleeding may be prescribed. Rehabilitation: Following acute treatment, rehabilitation may be needed to help patients regain lost function and improve quality of life. Conclusion: Intracranial hemorrhage is a serious medical emergency that requires prompt recognition and intervention to prevent potentially devastating consequences. By understanding its causes, symptoms, diagnosis, and treatment options, healthcare professionals can optimize outcomes for patients affected by this condition.